Hi, my name is Satoshi Ezoe, Director of the Global Health Policy Division at the Ministry of Foreign Affairs. So, in order to control and contain the current spread of COVID-19, international cooperation is essential, besides domestic COVID-19 response. To this end, Japan has contributed over 1.5 billion US dollars in providing emergency loans amounting to up to 45 billion US dollars for COVID-19 response in developing countries. This assistance includes strengthening healthcare providers and public health systems. Japan is a co-founder of ACT Accelerator, which is a global collaborative framework to ensure fair and equitable access to vaccines, therapeutics, and diagnostics for COVID-19 globally, especially for developing countries. For our part, Japan has contributed 228 million US dollars for these critical global efforts. In terms of global access to vaccines under this framework, Japan has pledged over 130 million US dollars in funding to the COVAX Facility. As one of the first donors to participate in the COVAX Facility, Japan is strongly encouraging other countries to participate as well. In September 2019, before COVID-19, world leaders gathered in UN General Assembly and unanimously agreed on a political declaration on UHC and committed to achieve universal health coverage, UHC, by 2030. Japan has been a keen promoter of UHC, led by the Prime Minister himself. Based on Japan's own experience of socioeconomic development due to our own UHC system, established 60 years ago, when we were still recovering from the World War II. COVID-19 crisis has reminded us in a harsh way of the need for global solidarity. And for that, Japan has been advocating for promoting universal health coverage, that is to ensure quality and affordable healthcare for all, founded on the principle of human security that leaves no one's health behind. Now, more than ever, everyone, everywhere, must be able to access the health services they need without facing financial hardship. And Japan is committed to promote this endeavor to promote healthier communities around the world in addressing COVID-19. Regarding our domestic response measures, we have so far been able to prevent so-called medical collapse and to mitigate fatal cases through three key measures. One, a high degree of public awareness on hygiene and a high degree of cooperation among the citizens in response to the government's requests regarding behavioral change, known as avoiding 3 Cs, which are closed places, crowded places, and closed contact settings. Secondly, control of new infections by the declaration of state of emergency and voluntary measures by citizens in response to the government's call. Thirdly, effectiveness of the counter-cluster measures to control the spread of disease. Having said so, we need to constantly adapt our approach in changing situations based on accumulating scientific evidence. In light of a resurgence of COVID-19 in Japan, the government has declared a state of emergency on January the 7th in Tokyo and surrounding areas. Japan is committed to tackle this pandemic hand in hand with the international community by sharing lessons and scientific evidence. I just want to reiterate that after all, no one is safe until everyone is safe. Thank you.